All right, good evening, everyone. This is Dr. Schilling with this week's Wednesday Wellness Minutes from Secoya Health. And we're doing a special presentation for one of our participants who asked us for information about what do you do when you have bone loss and can stem cells be beneficial for that? Anytime you think about stem cells, think about regenerative cellular therapy. We're really focused on getting the cells to heal themselves and activate the immune system in terms of providing the body the tools it needs to help itself. So when you think about stem cells or regenerative cellular therapy, you want to think about these cells can potentially help fractures heal faster. You can help surgeries recover faster. You can even possibly prevent bone loss, prevent aging, injuries, and things like that. So bone loss disorders and stuff like that. People are most commonly associating bone loss with a term called osteoporosis or osteopenia, which are both just indications of the level of bone loss or the density loss in your body. So you just want to keep that in mind. Some statistics that are helpful to understand when you're talking about osteoporosis or bone loss in general. Most likely upwards of 5 to 10% of men over 50 have bone loss that could be categorized, I think, as osteopenia, but osteoporosis defined by the characteristics that they define is about 4% for males above 50, and 16% of females above the age of 50 all have osteoporosis or bone loss to that extent. So it's pretty significant. And when you think about the total cost of osteoporosis in this country alone, in the U.S., every year it's about $16 billion. That's with a B. And that is an excessively large amount. So people are taking Fosamax and all these other things, when what they really need to do is exercise and do weight resistance training, proper nutrients like green leafy vegetables and healthy proteins and things like that. But when in doubt, we'll have more information on that. One of the things we find in the world of spines is spinal fusions. And if you know anyone who's had a spinal fusion and has had it for any length of time, generally speaking, there's a lot of pain with that. And I just give you this as a frame of reference. We're going to get to the jaw in a moment. What you want to understand is that about 391,000 spinal fusions, just about 400,000 spinal fusions occur in this country every year. And what happens is when you have 3 segments and you fuse one in the middle, eventually the one on the top and one on the bottom are going to wear out. So that's helping understand how osteoporosis in the spine can affect that. And it's about a $115,000 surgery for each one of those. So you can multiply $115,000 by 400,000, and that's a lot of money. Okay? So when in doubt, and you're wondering what a surgeon might recommend for you as far as a degenerative condition, well, if you go to a mechanic, and what do you expect, right? Well, here's a recommendation for fixing your car. If you go to a surgeon, well, here's a recommendation for surgery. So just keep that in mind. If when you want alternatives, you come to us and people like us. One of the common things associated with bone loss in a general scheme is hormone dysregulation. And a lot of women, either because they think it's the end-all be-all cure for their hormone dysfunction or whatnot, they get hysterectomies or ovariectomies is the proper terminology, or they get their ovaries out, or even women that have polycystic ovarian or polycystic uterine tissue, endometriosis, and things like that. They end up getting the tissue cut out because they think that's going to fix all their problems. When it's really usually the liver can't process all the hormones and they have blood sugar dysregulation, stuff like that. But osteoporosis happens at age points due to decline in sex hormones, sex reproductive hormones. But there's also dysregulation in the hormones related to blood sugar and chronic stress. And those are probably 2 of the bigger ones. And then, of course, the liver is a detox organ. If you can't process your hormones out, then they recirculate and they build up tissue and density and things like that. It's for another day. But if you want to know more about bone loss in general, refer to our Wednesday Wellness Minutes from May 22nd of this year. That'll give you information about osteoporosis in general. Bone loss is what it's labeled as. I think we call it got bone loss, taking a sort of a joke off of the got milk campaigns, and we talk about got bone loss because, of course, everybody thinks if you drink your milk and eat your yogurt and your cheese, you're going to have plenty of calcium. And we dispel that myth in that video. So if you have any curiosity about that, go for it. As you will learn about in that video, there are infections that can happen in the jaw, which we're talking about today. Metal in the teeth that shut down the parathyroid and thyroid, which, of course, parathyroid controls calcitonin, which is a hormone that affects your bone density. Injuries to the jaw, to the teeth. Problems in organ systems distant to that. If you look at a Chinese medicine chart for the teeth, you can see all the meridians that are connected there. So you can have a problem in your liver, which then reflexes up to your teeth. Your teeth start to decay in that area, which, of course, teeth are an extension of your bone. Okay, so when the teeth go down, you don't have to guess. What's feeding the teeth is the bone and the vasculature up there. When that breaks down, you're going to have problems with your teeth. Think of teeth problems as canaries in the coal mine for problems elsewhere in the body. So, for example, one woman today, she had metal in her teeth, and I was able to help her see on the chart. And when you trace those teeth back to the organ system, you have to ask what came first, the chicken or the egg. Did the tooth decay first, or did the organ system break down, and then that resulted in reflection to the tooth, and then the tooth became a problem, and the tooth, of course, is a sign of an underlying jaw problem. So you got to figure out what works for you, what your reason and what the cause is for your problem. But getting to our participant-specific question about how can stem cells or regenerative cellular therapy support jaw, because she's discussing this issue for herself and someone she cares about, where they've been told they have bone loss in the jaw by their dentist, and they're not really sure what to do about it. She reached out to us and said, can stem cell or regenerative cellular therapy be beneficial for people with bone loss in the jaw? And the answer, of course, is yes. Because think of the cells that are harvested from donated umbilical cords and amniotic fluid as being able to reproduce or turn into whatever the body needs them to be. Okay? So if you were to take your blood out and spin it down and create PRP, which is something we also talked about recently, platelet-rich plasma, and inject that into the area, because bones are known to have limited blood sources, limited blood pools. Okay? They make blood cells, like red and white blood cells, but what they do is they have a limited level of the bone or the blood supply themselves. And as a result, what you're dealing with is something that's unable to heal as well. That's why when teeth and bone are affected by lack of blood or congestion, like for example, if someone has a common bacteria we find in the small vessels around the teeth is called Bartonella. Strep is also common there as well. But that can clog the arteries that feed the teeth and the jawbone, and it can cause that decay to happen. Okay? So limited blood supply in the bone is a problem. So stem cells can become bone tissue, they can become periodontal tissue, they can become connective tissue, which is like the intracellular matrix that holds everything together. It can be blood vessels, create new blood vessels to feed that area. So when you think about stem cells and you were to do injections specifically in that jaw area, it's going to help regenerate that area of the jaw, and those teeth will help start recovering faster. So when you bring them to the area of the problem, it will help that area. It could be a knee, it could be a shoulder, it could be teeth or jaw. There are there are many practitioners that do regenerative therapy for the face. They're actually providing more fullness to the face. So it's basically, regenerative cellular therapy is going to take the place of Botox, because Botox is actually a toxin, botulism toxin they take out of nature, inject it, which is causes paralysis and makes you kind of look like this, kind of funny. Hopefully that ends up being the thumbnail for the video. But stem cells will actually help create more vasculature, help more fat tissue grow there in places you want it to, and things like that. So it will help your jaw regenerate itself. You always have to back up and say, why did my jaw break down in the first place? Why are my teeth rotting in the first place? Is it the organ system? Is it the tooth itself? Did I have an injury? It's things like that. So think of stem cells when it comes to the beauty industry, as we've already become accustomed to putting creams and stuff on our face to help, hyaluronic acid and stuff to plump our skin up and get rid of the wrinkles and stuff like that. When you're using these tissues that would normally be thrown in an incinerator, it's going to strengthen your jaw, your tissues, your eyes, everything in your body. If you were to do something intravenously, like the clinic we work with down in Colombia, that's going to help the whole body. So that's people we talked about in previous videos about MS, ALS, Parkinson's, and all these degenerative systemic issues that we can't do in the U.S. because the FDA won't let us. Interesting research, they're trying to isolate particular proteins and genes within the genome to activate more of the osteoblasts, which are the bone building tissues or cells in the body. So you have these little guys called osteoclasts, and they're like Pac-Man. They go around, they munch, and they break down bone. It's called resorption, or resorbing bone. Whereas you have the osteoblasts, which are building. Think of B as build, C as crash. I don't know, maybe lack of a better explanation. So the osteoblasts are going to build things up. So they're looking at these proteins, one of which is called WISP1, and so it's WNT1. It's like an inducing signaling pathway protein, all these fancy words that these scientists are figuring out. But what that's doing is that's playing a key role in activating the stem cells in the perivascular, so peri meaning close to and the vascular meaning blood vessels, because all the stem cells in your body are near your blood vessels. So when your immune system, when your brain identifies an injury and it says we need these guys to go in there, it's like sending the National Guard into a panic state and making a state of emergency. It says, okay, your brain says we got an injury here, we're going to send the stem cells in. So they just hop off the perivascular portion, they jump in the blood vessels, and they go right like a heat-seeking missile to the area of injury. So when someone does things like systemic stem cell or regenerative cellular therapy, they need to make sure they're not totally inflamed everywhere in their body, because where the highest level of inflammation is, these cells will go. It's like a heat-seeking missile. Okay? When there's inflammation, there's heat. Therefore, if someone had a super inflamed gut and yet they're trying to fix a degenerative condition in their brain like ALS, MS, Parkinson's, things like that, if a bigger fire is burning down here, it's not going to go here. Just keep that in mind. That's why we counsel people to always adopt an anti-inflammatory diet, the Vitality Food Guide or anti-inflammatory diet we talk about, which will decrease all your consumption of the highly inflammatory foods, which will help you feel better. But this WISP-1 protein is going to help you decrease fat production and increase bone production in those areas. As I mentioned before, in order to increase the effectiveness of these cells, we want to use the platelet-rich plasma. So we draw out the blood, put it in a centrifuge, spin it down, pull off the PRP, and put that back in. And think of the PRP as like the growth factors. It's like the special sauce, and it's going to promote the healing. But it's also going to stimulate your body's own natural healing response, because it's going to increase the blood flow in that area. And if you've ever hit something and you get that, like let's just say you took a hammer and smashed your thumb, right? It doesn't feel very good. It gets all big and red. You've probably seen it in a cartoon somewhere along the way. But it gets red and hot and irritated and it's pulsing and things like that. So that's going to, your body's going to say, okay, my healing response is to increase blood flow there and get the junk out. Okay, so it tries to push everything in there. And that's what somewhat of what PRP does, the plasma and whatnot. But it also acts like fertilizer. So what it's going to do is it's going to help activate the tissue growth factors that are in that area and help supercharge the healing ability of that tissue. So when we inject the PRP, in this case in the jaw, it's going to increase the blood flow to that area, which is already a low blood flow area, given that it's mostly bone. And if you ever look at the blood flow to the jaw, they're like, imagine a bunch of whiskers that run along the jaw to feed the bone. It's a very, very limited blood supply. So when there's injuries there or decay, it's hard for it to recover, especially if there's rotting teeth in the area. So keep that in mind. We are focusing on what are called allografts, or donated stem cells, or these regenerative cellular therapy cells. And that's going to come in the form of predominantly amniotic fluid and then umbilical cord cells. Those are what we use as far as strengthening the bones and the infrastructure of the bones. Because what it can do is it can increase the plasticity, like the stretchiness or the flexibility of it, so they're not so brittle, and if they get hit, they crack. So you need some flexibility in the bone. You don't want it completely rigid, even though it feels super hard. There's some give to it. Otherwise, you'd walk around and snap bones all the time. But it's going to increase the strength and the elasticity of it. Other forms outside of what we use which are amniotic fluids and cord cells. There are bone marrow aspirates, and there are fat-derived stem cells. And the big challenge with those two, think of first and foremost, if someone has to drill in your bone, like down in your hip bone, and pull out cells. That sounds like a fun process. And it's well known to be very painful. And the other side of that is the fat cells. So what they do is, you've heard of liposuction. What they do is they actually think, oh, well, we're throwing these cells away anyway. Why don't we just harvest the stem cells out of that fat tissue? Which indeed, there are some stem cells within fat cells. The problem is, fat is where you store your toxins. And so do you want to take a cell that you're supposed to use to help regenerate your body, which has been sitting in a bath of toxic fat, if you will, for lack of a better explanation? Do you want to harvest that cell out, having it been in that environment, and then inject it into your joint or in some other part of your body? I would argue that it might not be the best option possible. We want to use something fresh and clean and that's not been disturbed and has been tested for cleanliness and lack of impurities and lack of genetic material that's going to cause you problems. So that's why we opt for the amniotic fluid and these cord cells, if that makes sense. Last but not least, of course, as you know here, we're very big on promoting an understanding of why a part of your body would break down in the first place. So when you look at the jaw and the teeth, of course, because the teeth are an extension of the jaw, and the jaw is bone, so we think of the teeth as bone. We want to understand why that area of your body might break down in the first place, because nothing happens in your body by chance. There's always something that causes it. So when you think of the jaw, you have to think about inability to chew on an idea or a situation or set of circumstances. So think of this as metaphysically, but in your life, you just can't chew on an idea. It's unacceptable. It's really frustrating. It could be inability to hold on to something. Think of a tug of war between you and a dog. Like, you got the toy, dog's got it in its jaw, and it's just fighting for dear life. That's for whatever dogs they get off on that. I don't get it, but the tug of war, they have that game. But inability to hold on to something, so that's part of the jaw as well. Inability to lock onto or hold on to something is a similar concept, but it's also related to oppositional defiance. That's why when you see kids get angry, a lot of times they're grinding their teeth and they're super frustrated, right? So that's how it manifests in your body. So if you have issues with inability to hold on to or inability to chew on circumstances or situations, stuff like that, or oppositional defiance, that can cause a brain-body disconnect, which results in your body breaking down in that area. Because you don't hold stress in your brain. Your brain is way too dynamic and way too intelligent to say, I'm going to hold on to that stress up here. That's why we start feeling pain down here. People get locked jaw, snapping, popping, quote-unquote TMJ issues. But then you can also have bone degeneration, teeth decay, and stuff like that. So it's really important to understand how the brain and the body are connected so you can be more empowered to understand that. As we mentioned, teeth being the extension of the bone in the jaw, think about the teeth as relating to inability to bite back. So that may be kind of hard to understand, but something happens to you and you feel like you can't do anything about it. Someone says something, you feel like you can't say anything back. Inability to bite back, that kind of concept, if that makes sense. So nothing happens in your body by chance. If you have decay in your bone and your teeth, there's something going on in your body, okay? Because if this is breaking down, something else down here or up here or a combination of both is breaking down, okay? So if you have a question about a part of your body that might be breaking down or a part of the body of your loved one that might be breaking down, let us know. Put it in the message below, give us a comment. We'll be happy to discuss that, help you understand that portion. If you're wondering about how regenerative cellular therapy would benefit you or someone you love and part of their body that's breaking down, we have the answers for you. You just need to let us know what you want information on, because we're here to provide this information for you and empower you to understand what your options are. And obviously you know by now, if you've been watching us for any period of time, we're providing information that is not part of the mainstream. This is not what your medical doctors are talking to you about, because that information is based on the standard of care for the medical department and the medical facilities and those physicians. We're going to help you understand the real root cause of your problems and what to do about it. So you want to understand your symptoms, where they're coming from, how to get rid of them, how to never have them again, then you come to us, okay? We're not here to save your life or keep you alive. We're here to increase your quality of life. And that's our job. That's what we're experts at. So let us know how we can help you and support you and your loved ones. And for now, we'll sign off, but we'll look forward to seeing you next Wednesday for the Wednesday Wellness Minutes. Take care, everyone. Bye-bye.